Minister, thank you for joining us. I know you have literally stepped, or you're in question period, you're about to go into question period. We're very appreciative to have you join us. Just briefly to talk a little bit about COVID 1000. We've had 1,000 days of this. You were on the hot seat through the whole time. We're now facing the next 1,000 days. And you can appreciate that we hear from all the urban constituencies across the country a concern about rising mental health challenges and how that is affecting return to downtown, main streets, housing, all those things. So we're very keen to hear your perspective in terms of what you see the priorities being for 2023.
Thank you so much, Mary. And I loved what you said about people and places. And avant de commencer, j'aimerais souligner que je m'adresse à vous à partir du territoire non cédé de la nation algonquin Anishinaabe, qui est le gardien de ces terres et de ces eaux depuis des temps immemoriaux. It's great that you're doing this, and for all the work that the Canadian Urban Institute does. And what a lovely way to frame it, saying that 1,000 days in, and now since COVID was declared a pandemic, but what are we going to do on the 1,000 days up? And I will say that my youth council has been very clear with me that they don't want to see any build back better stuff. They don't want to go back to anything. They want to leap forward into something that's way fairer, way greener, and more inclusive. And so this is the opportunity, I think, to as we're coming out, to be able to have a vision for what really would work. And as you've said, it's no secret that the pandemic has taken considerable toll on individuals and families across the country. Isolation, financial employment uncertainty, the increased stress, anxiety, depression, loneliness, domestic violence, and I think as we're hearing from the FCM this week, that even the main streets look different in terms of homelessness, people using drugs, that this is a concern as to really how it has landed in our urban centers in a different way. So I think that it's, again, the stats bear it out that more than half of people in Canada are feeling that their mental health has worsened since the beginning of the pandemic. I think that we believe that the fact that people are admitting that and are maybe talking about it amongst their friends, that maybe that's helpful in what we know we have to do in reducing the stigma, that if people are prepared to admit that they're struggling with mental wellness, but maybe even struggling with increased use of substances during COVID, that it will help take away that barrier to seeking care that is stigma. And so we also know, as you know, that to make matters even worse, the illegal drug supply has become even more toxic with fentanyl, carfentanil, but also the addition of benzodiazepine, which makes it much more difficult to reverse an overdose with naloxone, but also the detox and withdrawal is very different and unpredictable, which means that detox centers and all these people who think they've gone through the withdrawal have a surprise much later because of how long acting benzodiazepines are. And so when naloxone doesn't work with 1 or 2 doses, and I think we see that on the street, it can be fatal if people don't understand the difference of the mix, and some people need 3, 4, 5 doses. And we are, I think that it's been amazing to watch really the frontline workers in our communities. Essential. On Monday, we met at the Powell Street Getaway, in the downtown East Side. People who have moved to become harm reduction workers from their lived and living experience. That we are, I think what we're seeing is we're really expanding our understanding of who is in our mental health workforce.
Right.
And it's not just with people with letters after their name.
No, and I
And
think this,
again,
one of the lessons we've seen from COVID is this whole notion of mutual aid, right?
Yeah,
Yeah.
yeah. No, and I also, I do think that this is been huge. I mean, who knew that we would have vaccinators?
Right.
That people could be trained to do a very specific task extraordinarily well.
Mhm.
And so I think that as we move to this different understanding, more inclusive, whether it's knowledge keepers and elders or peer support, peer expert, that this is really expanding, I think, the understanding of who can help, as you say, Mary, in the mutual support. It is, I think yesterday we did a roundtable with the community and service provider leaders from across Canada, Boys and Girls Clubs and the Y, and they have been telling us really for over a year now how their frontline are burning out, but how they're not feeling appreciated and how they're not tend to be thanked in the way that maybe the uniformed first responders or in the hospitals. And so we want to know, how do we build that community and service providers into, I think, what Kwame McKenzie called the resilient community.
Right.
And how do we build in that necessity of putting the oxygen on yourself before you can be good to anybody else, like out of the public safety demonstration on aircraft. How do we make sure that people know that in their plan, even with a grant application, how do we make sure that they are taking room and resources for themselves in order to continue to be able to do this hugely important work, that we can't afford them to burn out and be away, and so how do we support them as they go out? And again, that idea of mutual support, Mary, I think is huge, but we also have to make it safe for people to admit when they're struggling or when they're not feeling valued. So we think that it's been really hard on the front line. The 7,500 people lost their lives during the opioid overdose crisis across Canada just that last year. But I think with the majority of those in Ontario, Alberta, and BC, but also the fact that really since 2017, 42,000 overdoses have been reversed in safe consumption sites, and how satisfying that works.
Right, just to keep that in perspective. Minister, I appreciate the bells are going to start to ring and you're going to have to leave us. We are keen to continue to have a conversation with you about how you, in your unique role and with your unique background, can continue to advocate for why we need this kind of holistic, all hands on deck approach to addressing mental health, so that our main streets and our downtowns and our housing environments can recover. So we look forward to working with you through the year because we know that, as you know, there are lots of good local solutions, and you're attesting to a number of them.
No, I think it's great. And I guess I just think that if how do we raise the mental health literacy of all Canadians? How do we get it into the curriculum? How do we make sure everybody knows what to say, what to do, and how to support one another? I think is going to be hugely important as we go forward, that when we were apart but not alone, how do we really change the way we see this, and in terms of what we learned in COVID around telehealth, and about how you can have the best possible treatment or supports, not necessarily in your community, but in your virtual community.
But get access to them. So, I mean, these are the kinds of innovations we're trying to make sure we get to stick. We did some stuff.
I think that as urban communities understand that, whether it's students that have gone away to school, whether it's Francophone, Indigenous, that there's post-op, there are ways of getting that support in. And that's the reason we're pushing hard now for the national licensure of health professionals, so that people can
move
across jurisdictions. It's the reason why Wellness Together, was stood up with the step care model, Kids Health Phone and Pocket Well. And I just guess that, And I think what all of your communities would really want to look into is what we were able to announce a week ago on integrated youth services. That the idea of having wraparound care for each youth, starting with the peer support, primary care, social work if they need a psychologist, housing, education, employment, addiction services, that wraparound care is now being part of the common statement on priorities of all the
Right.
territories.
Well, I'm going to leave you and go to a session right now from Victoria, which is going to talk exactly about that kind of collaborative approach that they took to housing people that were vulnerable during the pandemic. So, Minister, thank you for squeezing us in. We look forward to continuing our conversation with you as the year progresses. Thanks for being part of COVID 1000. Really glad to have you on.